Don't be afraid of technology. It's here and it's real. Really look at integration of your technologies and making sure that everything, can work together. And, I think the third is, technology is not only improving quality of care, but it's improving quality of operations. So if you're interested in learning more about these topics, please check out the podcast with Joel and I at the link below.
Welcome back to Next Gen by NuCare, the podcast for senior living providers who don't have time to find the right solutions for their own businesses. If you want the latest technology and practices for senior living, this podcast is for you. My guest today is Kandice Alcorn. She's the founder of KRA Consulting Services. Kandice is a unicorn in senior living as a nurse and technology expert. Kandice is going to be addressing three main factors. One is don't be afraid of technology, embrace it. It's something we have to use in order to move forward in senior living. She's going to be talking about AI and robotics and how that can help provide services that you can't otherwise get to. And then finally, discussing the importance of efficiency in providing those care and services and getting better outcomes for our residents. Hi, Kandice. Thanks for joining us today on Next Gen by NuCare podcast. I wanted to bring you on the show because you have a very unique and broad view on where technology is leading us in senior living into the future as we're truly creating a new way of providing care and service for our residents. So welcome, and why don't you give me a little bit of what you've been up to lately and where you're headed down that path with technology and other things.
No, thank you, Joel, for asking me to be on. Technology as a nurse has been one of those things that you either love or hate. I have really embraced technology over the last few years, especially in senior living. We are faced with a growing population of residents that we're providing care for, but yet there's not enough people or staff members to continue to provide the level of care. So it becomes the matter of working smarter, not harder. And ultimately, I believe technology is the way that is going to take us there. I've worked with several different groups. Quality is always huge in my book. So working with quality assurance teams and helping them really understand there's great quality assurance technology out there, but having one that really understands senior living has been somewhat of a challenge. We are kind of a unicorn in the healthcare world. And so I've worked with a group to really focus on quality assurance. I think the robotic industry, as far as technology, is going to be amazing. The first time I put a robotic server into a senior housing community, I have to be honest, I was a little scared. I was like, are they going to run over people? Are the residents going to hate them? What's going to go on? But the residents actually loved them. And it was fun because you could do so much with, recognition. The robot that we had actually sang a happy birthday. So you could tell that Mary Smith was sitting at table 2 in seat 4. And when they delivered Mary's food to her, it automatically sang happy birthday. And so there's just a lot of fun too that technology can bring to the industry. There's challenges as well.
No, that's great. I have not had the pleasure of using any of the server robots in the communities we operate, but that sounds like a really great opportunity. You had mentioned, quality assurance teams, and which comes into, compliance and higher care levels and things like that. What are some of the things you're seeing? We've been testing some technologies and devices, wearable things, and other things out there. What type of things are you seeing?
I think the wearable industry is very interesting. I unfortunately have been a naysayer of all the fall technology in the world when it first came out. It's proven me wrong. And so I do think there is a place in the industry for those kind of things. You know, I would say as an operator, my concerns were, you know, what does it do to our liability? Does it increase our liability risk? You know, what does it, how do we define it? How do we, you know, include families in it? All of those kind of questions. But the technology piece in the wearable world has exploded. And I do think wearables are going to really be the wave of the future for falls versus just the static cameras and those kind of things. Because as a nurse, I was always like, but what if they're out in the courtyard and they fall? Or what if they're in the dining room and they fall? How do, you know, a camera in their apartment isn't necessarily going to tell me those things. So how do we make all of that work? And I think that's where wearables really come in. There's devices now that look like watches. I mean, you put a watch on me when I'm 90 and have dementia, I'm going to wear it because I've worn a watch my entire life. But you put one on my husband, and he's going to take it and flush it down the toilet, likely, because he's never worn one. So I think they have to be really resident specific. There is some new technology that is going to be coming out in the near future that I've heard about that actually is more like a patch. And so it doesn't, it's not as easily removable, kind of the out of sight, out of mind theory. And you can actually like put it on a resident's low back. Um, have it's not hit the market yet, but I've been working with some developers who have asked me to take a look at it and give some input and insight to it. So I think that will be extremely interesting and, you know, likely very helpful for those residents that you know, wearables are not successful with. Um,
I that makes a lot of sense because I do a lot of memory care in our communities, and certain residents would be great with it and others not. So there has to be another way to put it than a wrist device or something like that. And so fall prevention is a huge issue because there's the falls that we have to try to the big falls, the big events that we're trying to prevent, and hopefully detect some, the silent falls, so to speak, the falls that no one witnessed and no resident didn't tell anybody about because they just got a little dizzy and sat down and then got back up and didn't want to. They were embarrassed, So those are things that people don't realize that are happening until a big event occurs. And then they say, well, this has happened 3 or 4 times, but I was afraid to tell anybody.
no, I actually was in a building the other day and I was visiting with a resident and they were like, I was talking to them, helping with their service plan. And I said, so tell me, have you had any falls? And they're like, yes, all the time. And I'm like, really? So tell me about that. And they were like, I just get back up, and I was like, that doesn't surprise me, but it's those kind of things that we can then, really start to build on quality, looking at trends, looking at ways that, when are those things happening? What's involved, all of that trending and tracking stuff that is kind of at the core of, true quality. But we don't have any way to capture that right now. And so I think this kind of technology is going to be extremely helpful in helping the next generation of seniors that we really, are providing services for.
Yeah, you mentioned something, and I have about 4 or 5 years in the insurance world. When you mentioned the liability aspect of technology and getting more data, and making sure that if you have data, that you're actually acting on it. Otherwise, you're putting yourself out there.
Yeah, and I think that's the key. I think senior living for a lot of years has been pretty good at collecting data. But I think we've also collected data that we didn't necessarily understand what to do with. We didn't realize the impact that it would have on the resident outcomes. I mean, I think you could probably go to any senior living operator and ask them, a whole list of data-driven questions. What's your conversion rates? What's your admission rates? What time of day do you admit people? What's your med error rate? All of those kind of things. And they're going to rattle numbers off to you left and right. But what we then do with that and how we actually implement that into making change in our practices, I think is the piece of senior living that we really have to start focusing on. Because God forbid those numbers, were not where we wanted them to be as an operator, then yeah, your liability is truly exposed. But I think having good data and acting on good data really does reduce our risk.
Yeah, and I think part of that, as these technologies are being developed, having associated recommended or best practices processes to follow up on the data, things to do, having quality assurance committees in place and active, and talking about your, whether you want to call them correction plans or action plans to get better, and giving people the training and the tools they need to do their jobs.
I was working in skilled nursing when the whole 5-star system came out. And I was horrified. I was like, oh my God, what is this going to do to senior living or to, skilled nursing? And you look at it and it's exactly what they were doing. It was just a publicly made forum for quality assurance. And so I've even started in with some of my clients that I'm working with, pulling in some of that, some of those very same key factors that I'm not going to say how many years ago, back a few years ago, were, new and thought provoking things for skilled nursing. I've been pulling in some of those very same data points to really help us drive quality in these senior living communities. It's all applicable. It's just, and we all know the residents we're taking care of today were those that were taken care of in skilled nursing, 5, 10 years ago.
Yeah, and when I was on that side of the fence, so to speak, working on the insurance side, we would help people. This was 8 or 10 years ago. Set up quality assurance programs that they didn't understand why, but then once you explain to them what you're trying to do, and that in most states you actually have laws protecting you if you go doing root cause analysis and things, really trying to find out what the problem is. That information can be protected as a healthcare entity. So you have protections in place similar to a hospital that's investigating what went wrong in a surgery. You can talk about things behind closed doors, but you do have to have certain systems in place in order to do that. And that's where, as technology continues to evolve, it needs to adapt to fit into those systems, so that you're not creating additional liabilities, as you said.
Yeah, no, absolutely. I totally agree. And I think, as senior living providers and operators become more tech savvy, and, all of our technology starts to work together, I think interoperability of technology is, the biggest key factor that we likely are missing in senior living. There's lots of great companies out there with lots of great programs, but when it takes either somebody with a computer engineering degree or somebody that, is doing nothing but data analytics to pull all that information together, then it's likely not going to be helpful. But if we can get it all in one place and all in one dashboard, then it all starts to make a whole lot more sense and to really work to move the industry forward.
Yeah, one of the reasons I've decided to do this podcast and bring in people like you was, I feel like I'm on this search for the holy grail, the solutions, and it's not a single item really. It's bringing, like you said, all of these technologies, these silos of data together to create better outcomes. one of the other things that you and I had talked about before we got on was, the challenge that we've been presented the with wages and the cost of labor in the industry. We somewhat fortunately, following COVID, we have a bunch of caregivers that now make significantly more money, which is great for them. It's wonderful that we can pay people a wage, and the talk about minimum wage and things like that are really not an issue, because in this business you have to pay significantly more than any of those things. And wages are up for caregivers anywhere from 30 to 50%, and those extra dollars are difficult to make up for in revenue, so we have to figure out ways to be more efficient. And so going down that path a little bit, how are you, what areas are you focused on? And you talked a little bit about the robot, but what other things are you looking at or trying to, find some answers for to become more efficient in care and services?
Yeah, absolutely. And I think, it's kind of multifold. So, if one of the things that I do when I first go into a building is I look at everything they're doing on paper, because I feel like paper takes time. It takes time to track. It takes time to pull all the data together. It just takes time. And even if it's like care tracking, we sign task sheets or whatever, that in and of itself takes caregiver time. Where if they can do it on a handheld device, or some sort of electronic platform, then it's much easier for even our frontline staff. So I'm really trying to look for, those kind of solutions. So depending on what group I'm working with, but when I'm looking at EHR software, I'm looking at, is it available on a handheld? When I'm looking at call lights, which I used to never think of as software, have become software. Um, in the recent past. And so when I'm looking at call lights, are they available on a handheld device? Can you communicate, you know, caregiver to caregiver or department to department on through that same system? How do those systems really, serve more than one purpose? Most of the new call light programs, I mean, PalCare, Sage, all of those that are coming out are able to really, allow for a multiple solutions. I'm consulting in a building right now that has a call light system that goes to a pager, but when I dug into the system, it actually has the ability to go to a handheld device, and it has the ability to just send out general messaging to the pager. And those communication is key in working more effectively. So you're not running all over the building, and when it comes to your frontline staff. And then as you kind of go up the ladder of things, scheduling. I can remember a time in my career we hired a person who was a scheduler. That's all they did was schedule. So it's because we kept schedules on paper and we kept schedules on spreadsheets and, keeping up with all of that. Now the technology is amazing when it comes to scheduling, and it can integrate with your recruiting platforms and so it's just a matter of kind of what seat you're sitting in as to what piece of technology is the most important.
Yeah, there's so many efficient technologies on that side of it, whether it's scheduling and timekeeping and recruitment and onboarding and through paychecks and benefits and whatnot. And I've personally, I spent the last 30 days evaluating a whole bunch of systems, and it's a little overwhelming.
It is. It is.
But the part that I really appreciated, because we have to be efficient not only with our care staff, but our business office, our back end operations, because you don't want to waste a bunch of labor there either. And there's certain systems out there that are more self-service. That's something I hadn't heard before, where essentially when that employee comes on board, they log in and put in their own information, and tracking their own stuff, and then scheduling, all part of the same system, and timekeeping based on the scheduling, and requiring the employee to verify, and requiring the employee to verify their paycheck before it gets paid out to them. So there's several checkpoints that hopefully cut down on some of the mistakes that can be made in that whole process of getting people the dollars they deserve, for the pay that they're working those hours for, and having all of that interacted, and as well as, there's a term out there, self-scheduling, that has become more popular, which is, you can plug in some of your standards, but allowing people access to the schedule to grab shifts, pick up shifts, add to their base hours, switch shifts with someone else, so you don't have to call that person, that scheduler that you talked about that you hired in the past. That position can be automated in a lot of ways. And getting notifications when someone's going to hit overtime, and or just when those shifts are being picked up, or being able to put incentives to pick up a shift when it's getting down to the last 24 hours or something. There's a lot of different things that can be done that really help put the employees in charge, of their own processes. So that's always kind of neat. So then, you mentioned EHR systems, and I, was one of basically the founders of an EHR system years ago. And, back then it was just really cool to just have that database of information online, so it was easier to be accessed. And but I think in the last couple of years, there's really been an evolution of expectations being raised. I don't know tell me a little bit about what you see happening specifically on the electronic health records and, medication administration and things like that.
Yeah, no, so I agree. I mean, I have um worked, I'm going to date myself a little bit here. I've worked on systems that at the time were cutting edge, and they were probably literally dot matrix systems. They were, they were homegrown, straight out of the ground, could barely, they definitely weren't where we are today. Up until the point that, I've also worked with programs where I help to, develop assessments and, those kind of things. The cool things that I'm seeing now is a lot of times the newer EHR systems, or the ones that have really grown and kept up, are becoming so much more comprehensive. It used to be something that nursing used, right? I mean, it was I need it to pass meds, or maybe I need it to, do an assessment and a service plan. And sometimes they talked and sometimes they didn't. And now they're so comprehensive and they're so customizable. That's one of the things that I think is just some of the big EHR players have done a really good job with, is allowing operators, because we all believe we know best when it comes to things like assessments and service plans, and the best way, the best questions to ask, all of those kind of things. And all of our states have their varying opinions on what needs to go into those. And so allowing the operator, give them a good solid platform, and then allowing them to have some customization into that has been amazing. The other thing is a lot of them are starting to integrate some of the quality pieces. You can at least get good reporting out of your EHRs now. And so you're not having to have a nurse sit there and, count missed meds, or, those kind of things. And some of them are also integrating right along with some of the other technology we've talked about. They're integrating with, or they have working relationships with, your billing platforms or your call light platforms. And so they're all really starting to pull together. I think, some of them are becoming more and more mobile. It used to be, oh, you had to have a laptop on your med cart to be able to do things. And now, they're even available on, smaller, more portable handheld type devices, which I think is amazing, which allow nurses to really chart right on the fly. And so that's super helpful. Um, so there's just lots of good stuff going on.
I've really, been talking with a number of HR systems and the dashboards and analytics that they're creating to make life easier. So it highlights where you need to be spending your time. So when your nurse comes in, they're going to see the 5 residents that have something outside of the norm, and then they can dig into it deeper. So there's less time. And then, another thing that you hear a lot about is, revenue capture. Are you providing a bunch of cares that you're not getting paid for? And highlighting that in the system if there's cares, PRN cares or one of tasks that are being provided to residents, and making sure you're not losing revenue on those things. And, there's 50 different states and 50 different regulations on what you can charge for, but it is significantly different than skilled nursing. You can charge for a lot of things. You can charge for services that may not truly just be healthcare related, and get paid for those. So depending on what state you operate in, the type of services you provide, and these systems are getting better about helping you make sure that you're getting paid for all the services that you're providing, which is really important to be more efficient and continue to provide those services.
The other thing that I've found interesting, Joel, is I was working with a company. We've all talked about predictive analytics and all of those kind of things, but as the AI world really starts to hit us, it was actually able to take your medical record data, scrub it, and based on occurrences of events, not necessarily, oh, Mrs. Smith has 14 meds and Mrs. Smith has had 3 falls, but on occurrences of events, look at predicting move outs. Occupancy being a huge key in everything that we do, being able to predict, those move outs with a very high accuracy, and or being able to predict that somebody's going to move out. And the prediction was like in the next 90 days, is there a way to intervene and prevent that from occurring? And it was amazing to me, the number one, the accuracy of being able to do that. And then number 2, the reduction in move outs and the increase in occupancy that providers, the provider I was working with at the time was seeing when using that. It takes work. It's one of those things that likely is going to fall back on your regional team because I always say the people in the community, sometimes they can't see the forest for the trees, um, because they're so embedded into the day-to-day lives of our residents, which is exactly where we want them to be, that, sometimes I think things kind of get taken for granted, that Mrs. Smith is just getting sick. Well, maybe not. Maybe there is something we can do to, get her back to the quality of life that she was having previously.
Yeah, and predicting move outs is the extreme side of it. And one of the things that I think will grow significantly is health monitoring, remote health monitoring that has become, across healthcare a really important tool, and growing that in senior living. And me living in Wisconsin in the dairy state, I visited dairy farms, the large productions where they have thousands of cattle, and you see these cattle wearing necklaces, and you say, what are those necklaces? Oh, it's monitoring their body temperature. And like, oh my gosh, and so they, we do that with our cattle, which, knowing what their body temperature is without having to go take their temperatures, so that, it's going to predict that if you can see a small body temperature change, if we could have that in senior living on a regular basis, there's a lot of things we may, hospitalizations and severe illnesses and things that we don't see until we see the symptoms. And, as I'm sure you know well that, UTIs are such a huge problem. And if we could see, just a couple of degrees change in body temperature, we might be able to head it off at the pass.
Yeah, absolutely. And there's some of the remote patient monitoring equipment that's coming out is literally like a box, like this size, that can go on a patient's wall. And when they're in bed, they monitor them all night long and can really pick up on a huge number of, vital sign changes and those kind of things that I don't know. There's part of me that goes, "Oh, that's kind of scary." But then there's also a part of me that's like, how wonderful is that to be able to identify those little bitty changes that can make such a huge impact. I think the other thing is being okay with change. I worked with a group that was really focusing on doing PCR testing versus your standard UA testing. And you know, understanding that, all of our docs are going to write a UACNS. It's just what they do, but providing them with the fact that we can do some of that advanced testing and be able to get more accurate results in a more timely manner and really intervene with somebody who may take 5 or 6 days to get full CNS results back on. If we can have that in 24 hours, we can prevent a hospitalization. We can prevent falls. We can do so much more.
So, real quickly, for those people, watching the podcast here, can you explain a little bit more in depth what the PCR testing is?
Yeah, and I'm going to give a real layman's version of this because that's exactly what my understanding is. So it's the ability to actually do almost the same kind of testing as we would think that we did for COVID testing. So it's more of a antibody type testing, and it gives us the true diagnostic bacteria that may or may not be present, along with a real and more in-depth analysis of this is the specific drug that will treat that specific bacteria for that resident. And so it's a quick turnaround. They're typically 24 hours. They can get a result in 24 hours. There's technology that's coming out. Everybody's that I've talked to is like, oh, but it's so hard to, get a sterile sample on our seniors. 100%. You're correct. It is. But they're coming out with technology now that you can actually place in a brief that does the collection that then you can run a PCR test on. And so there's just so many things that are moving into a higher level of transparency and a higher level of treatment for our residents that I feel like, it's going to make a huge impact in the future.
Yeah, it really is. And, with the UTIs in particular that are such a problematic issue. And, we all know that someone with a recurring UTI, it just never went away, and it's not getting treated properly. And so then you treat it and treat it and treat it, and it really just, fades a little but doesn't completely go away and then flares back up. And
And then you have a multi-drug resistant situation on your
yeah,
hands, and that's even a whole nother set of complications.
yeah. So yeah, using some of these newer methods and technologies and being able to truly monitor people. I know I've had some hip resurfacing surgery in the last few years, and one of the most annoying things was somebody coming in to take my vitals every couple hours, and I'm thinking, why can't you just, why can't you monitor this remotely and then come in if there's a problem, because I don't need you to wake me up. I'm fine.
Yeah, exactly.
And
Well, and that's just it. Most of our residents are fine too.
mm-hmm.
And yes, they're elderly. Yes, they have multiple comorbidities, but they're not necessarily acutely ill. And so sometimes they feel like the things that we're doing are so invasive, for them. And so remote patient monitoring allows us to do that preventative monitoring that we need to be able to do, but yet it doesn't impact their day-to-day life.
Right, exactly. And that's where, as you said, most of the time they're fine. And, there's nighttime monitoring, manual monitoring of residents that still continues, and 2-hour bed checks and things like that, that I joke around with people, but I'm pretty serious. If I, several years from now end up living in an assisted living community and somebody wants to come check on me every 2 hours, I'm going to put a bookcase in front of my door so that you can't open my door. And if I'm going to pass away, I would want to do it at night sleeping, and you can, find me in the morning. You don't need to come and check on me every 2 hours. Now, I understand that, you're checking to see if they fell or had something happen, but that's where some of the remote monitoring is extremely helpful to let people sleep at night. Elderly people who don't have good sleep patterns, who can't stay asleep, and wake up every time you open that door to check on them. It's really disruptive to their schedule. And there's somebody giving me a story a few weeks back of that 2-hour check happening, and then the person sitting up in bed and just saying I'm fine, and then plopping back down in bed, and they got to the point where they didn't even remember doing it anymore. It became such a habit for that resident, and that's just really sad. And as you said, most of the time, because everyone is okay, 99% of the time everyone's fine, you start to wonder if your employees are doing every one of those checks, and for good reason. How many times are you asked to do a job where 99% of the time the task you're doing has no results? And so it's really difficult to ask employees to continue to do that when they could go weeks or months without anything occurring, and they have to check 20 or 30 or 40 residents.
I agree. Yeah. And, even if you think of that whole cycle, that whole sleep cycle, Joel, I mean, like if people don't get enough sleep, if I don't get enough sleep, I'm grumpy. Okay. And if you don't get enough sleep and you're grumpy in a facility environment or a community environment, and you do that enough days in a row, guess what? Now you're going to have more medication added because you're depressed or you have anxiety or, whatever the diagnosis is that they want to give you. But really, it's because you're coming in and waking me up every 2 hours, you know?
Several years ago, my dad he had, I think, his open heart surgery at the time, and they were coming into the ICU every morning at 4 a.m. to restock his room. And we just happened to know the CEO of the hospital, and we said, Frank, this is ridiculous. 4 a.m.? I understand you have to be efficient. I understand you have to do this. But he can't wait to go home and get out of this, not because of everything else. It's just because they come and restock his room at 4 a.m. and then he can't fall back asleep. Isn't there a better way to, whether it's him or other patients in your hospital, this is crazy. They can't live around your schedule.
Yeah. Well, and if you think of our residents, and this is their home, and if they were someone, maybe they were a caregiver who worked night shift, and you come in at midnight and wake them up, guess what? They're going to be up all night long. And it was something that we created. Maybe they were able to doze off before, but that's an environment that we've created. And so having technology, falls technology to monitor them, remote patient monitoring technology, all these different technologies that can really drive and do what the 2-hour check was intended to do. I mean, then we have better quality of sleep, better quality of life. And that's what we all talk about is wanting better quality of life for our residents. That's our goal, right? And so sometimes I think we want residents to conform to our schedule as care providers and not always remembering that, we're being privileged enough to work in their home and we need to conform to their schedule. And I think, technology is going to be huge. If somebody wants to eat in the room, think about having robots that can go up and deliver or go deliver to a resident room. They do them in hotels.
Right? Why not? Yeah. So, Candice, we've been talking for a while, and I truly appreciate that. And I can you give me the top three impact technologies that you see? Maybe things because you're working directly with or testing or have heard about, but three things that you think really are going to make a big difference in resident outcomes, resident lives, efficiencies at communities.
Yeah, absolutely. So I firmly believe as an operator, the top one for me would be the move out predictor technology and some of the AI stuff, because I think that's going to be super impactful. When it comes to resident life and resident quality of life, I think the good wearable falls technology is going to be super helpful. I believe the integration of wearable technology, call light technology, and then, for resident population, I would probably say even the robotics, just because it almost increases the amount of staff, so the responsiveness and the frequency that services can be provided. If you think of the number of times that your care staff are going to residents' rooms for things like, I need another glass of water, or, can you deliver this tray to, Mrs. Smith, or, those kind of things, it just increases our efficiency. And I think efficiency is going to be the key, as there's not, hundreds of thousands of caregivers out there, as our boomer population really starts to come into senior living. We're going to have ways to not not have, and 1,000 more people, but yet be able to provide the service like we have 1,000 more people.
The best way I've explained it to people is, in the past it was kind of cool, or we should do this or we could do that with technology, and now it's we must do this in order to survive, in order to really keep up with the acuity levels of the residents we're serving, in order to do it in an efficient manner that we can stay in business. We have to adapt technology. We have to be moving forward with this in senior living. And in the past, it was, well, it would be nice if we could, but we we can get by with not doing it. We always have. Then, so sort of backing up completely, tell me a little bit how you got to this point and became a nurse who's into technology. That's very unique.
Yeah, no, absolutely. So, I started as a caregiver at 15. I have grown up in senior living. I worked a couple of years in a hospital when I graduated from nursing school. I was just like every young nurse out there, and I was going to solve all the world's problems working in the hospital, and soon realized that I missed my geriatric population, and went back in. I worked in the skilled world for a number of years, and have just kind of grown my way through that. I'm kind of a geek at heart when it comes to liking technology and liking new things. My husband says if there's something new techie on the market for your home, I'm going to be the first person in line to buy it. But with that same thought process, I felt like we could do better in senior living by having some of those technologies. And so I've really just kind of gone out and started meeting tech companies. When I would go to, the industry meetings and stuff, I spent all of my time hanging around the technology groups. I wasn't too concerned about your product, or, I just wanted to talk about efficiencies and, like, what is it that you're really doing? And, how are you focusing on senior living? Because I think the skilled world has had a lot of good technologies, but those skilled technologies don't translate apples to apples to our world. And so really starting to just talk to people about those. And I've been fortunate enough that there's a lot of really good technologies out there that are willing to listen. And so I've jumped on several product committees and, tried to do as much as I can to just really help people understand what senior living is and what the challenges are that we face so that they can improve their product.
No, appreciate that. That's really great. I really respect you for that because this is where we have to be now. This is where the industry is moving towards, and you bring a lot of unique experiences to the table. From being a hands-on caregiver, a nurse, a manager, all of the things. In smaller communities, I'm sure, and then in very large corporations, and it's ultimately we're caring for residents, and we have to figure out the best way to do that in the long term, and incorporating different technologies and AI and predictive analytics and things is the only way we're going to be able to continue to keep up with all of the residents that we need to serve.
No, absolutely. And our residents and our residents' families expect that we have technology. They've been in the hospital. The hospital is 100% technology at this point in life. Maybe they've been in a skilled nursing unit and they had lots of cool technology that did things. And then they come to senior living and they expect that. They expect that we're going to be able to keep up with the rest of the healthcare industry. And prior to COVID, me saying the healthcare industry probably would have been shunned in senior living, but we've made a mark for ourselves that we are truly part of that continuum of care. And so based on that, we have to get on board. We have to move and continue to grow and expand in that technology world.
Yeah. Well, Kandice, thank you so much for your time. I truly appreciate this. I look forward to talking to you and staying in touch and talking more about all of these unique things that are out there, and sharing some of the products and services I'm seeing as well with you, and helping each other continue to move forward in senior living. Kandice, so how can people get a hold of you, contact you if they want to talk to you more or utilize some of your services?
Yeah, absolutely. So I am on LinkedIn under KRA Consulting Services. I have a website out there under KRA Consulting Services. Look me up independently on LinkedIn. LinkedIn is probably my best friend at this point. So, but no, I appreciate the opportunity and happy to speak with anyone.
Awesome. Well, Kandice, thanks again for your time today. It really was extremely helpful. I look forward to staying in touch with you as we move forward in the senior living industry.
Sounds great. Thanks, Joel.
You bet.